I'm sorry, I don't want to be rude.
I'm
Sham. Nice to meet you. And I'm sure you've already met.
Yes.
Yes.
Okay, good.
Okay.
Yeah, welcome.
Did you get one?
I think we sign one.
We all get
The board signs one, and then attested by whoever.
Are you ready to stand up here? It's sort of fun. Be like, you're sort of like in
We've been meeting at the Portage office for the past 2
the
in a small conference room.
Yes.
Sit around it.
just like a like conference tables. Yeah.
I get what I
like we're the big
Yeah, this is like the big. We're back.
Yeah.
Yeah.
It's like Thanksgiving.
You haven't been. Have you been here? We met here. Right. Every meeting has been recorded.
I mean,
Okay. Right. Right. But yeah. Not a bunch. Yeah. So this will be. Oh, and then Patrick is here. Right. How
Is it 5:30?
Are we at time?
years? Okay.
Good evening.
I just got it.
Don't worry, there hasn't been a coup,
Maybe there's.
but I have some organizational responsibilities tonight, and I figured I should use that as my rare opportunity to show some power and authority around.
You did.
Okay?
You did it. But
He never got that judge yet.
If we can rise. And Patrick, could you lead us in the pledge?
to
The flag of the United States of America
and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Absent an indication to the contrary, I'll accept a motion to approve the minutes of January 7th, 2025 meeting of the Porter County Board of
Motion
Health.
approved.
second.
All in favor indicate such by saying aye.
Aye.
All opposed? Our minutes are approved. Moving on in the agenda to item number 3, our next board meeting is scheduled for March 4th of 2025. Patrick, if you could come up here and join us. Patrick has found something better to do on the first Tuesday of every month. Can't imagine what that could be.
Stop bragging.
Yeah.
Why don't you have a seat?
Uh-oh.
Chopping block.
Patrick, we're all laughing because if we weren't laughing, we'd be crying. Your departure from us is something that we need to accept and tolerate and move on with. But your presence as a board member and your participation in the process through the good times and occasionally the bad times has been overwhelmingly accepted as a guiding light. So thank you.
Thank you.
The board has asked that we consider the following resolution. A resolution commemorating Dr. Patrick Fleming for service as a member of the Porter County Board of Health. Whereas Dr. Patrick Fleming served as a member of the Porter County Board of Health from May of 2019 through February 2025. And whereas Dr. Patrick Fleming was a dedicated, committed, and diligent member of the Porter County Board of Health. And whereas Dr. Patrick Fleming did during his service as a member of the Porter County Board of Health faithfully and conscientiously discharge his duties and unselfishly put forth his talents and knowledge in service to the citizens of Porter County. Whereas the Porter County Board of Health is desirous of publicly and officially expressing its gratitude and appreciation to Dr. Patrick Fleming, and in so doing acknowledging and memorializing the dedicated and committed service of Dr. Patrick Fleming as a member of the Porter County Board of Health. Therefore, be it resolved by the Porter County Board of Health that Dr. Patrick Fleming should be and is hereby publicly commended, acknowledged, and applauded for his years of dedicated service to the citizens of Porter County as a member of the Porter County Board of Health. All of which having been resolved this 4th day of February 2025 by the Porter County Board of Health. For adoption of the resolution.
Motion to adopt.
Do I have a second?
And a third and a fourth and a fifth.
Well, before I called for the vote, I was going to pause for a second and ask if there was any board member who wanted to have anything to say.
I thank you tremendously, Dr. Fleming, for being by my side through these years that I've been on the board with you. You've been a great source of leadership and guidance. Kept me educated, calm, and I consider you a partner in the work that you've done here. I thank Candace U. Fleming for giving him up to us for the time being, to help us navigate through these last few years.
Thank you.
I appreciate you more than I can.
It's a privilege.
Thank you.
Dr. Fleming, if I may, I just want to tell you, I know I've only been on the board for a short period of time, but I've known you much longer than that. I have the utmost respect for you. You are an incredible physician. You take care of some of my family members and they love you. Every patient I've ever come across in the urgent care or that are not my patient that have you, love you. You are an incredible asset to not only Porter County, but our community. And I wish you the best in everything you do. And I thank you for everything you've done.
Thank you for being here.
Anyone else?
It's fine. I appreciate it.
We haven't passed it yet. Just a minute.
Okay.
Not that we're having second thoughts.
I have a few more paragraphs.
You'll have your opportunity.
He hasn't banged the gavel yet.
Seeing no other comments, I will
Goodness.
call for a vote. All in favor indicating adoption of the resolution, indicate by saying aye.
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 All opposed? It has been passed, and we're now going to give Patrick an opportunity to have a word if he is so inclined. He's often a man of few words, but we'll see what he has to say.
Tell Candace. No, it's been a privilege, and to your points, even before a lot of funding, I was working with a group of people, all like-minded, similar goals. The agenda was directed towards helping guide and serve the Porter County Health Department, and I appreciate it. I will always remember it for lifelong, and if not, my wife will remind me. And so I it's very kind. You did not need to go through all of this, but I really appreciate it.
That's what makes it important. We didn't have to, and we're choosing to do it anyway, Patrick.
Well said. Thank you, and thank you to you all.
Thank you, Patrick.
Thank you.
And I will be available until about 7 o'clock. My phone will be on.
Should we page you?
Got a number.
Okay, I'm going to pass around 3 copies of the resolution. I would ask that the board members execute them.
The paper.
Linda's doing it already there, but go ahead and now you can go do whatever you've decided to
Yeah.
do on Tuesday nights.
Thank you.
Thank you, Patrick.
Does it need to go?
I already
And then will it go back? It or no? Okay. All right. So Michelle, I think it's back that way.
You're not up.
You want to?
But I can tell that you're on.
I got Gogo at guard. So nice to get like you.
Fine.
Oh,
Sorry.
You know, you just enjoy the moment.
Oh, the
Patrick, I would ask you to at least stay long enough I can give you a copy of this. So don't run real quick.
I have a terrible sign.
I know. I figured.
Okay, back to work. The next thing we need to do is elect from your membership a chairman and a vice chairperson. So I will remain in control of the gavel and ask for any nominations for the position of chairman of the Porter County, chairperson of the Porter County Board of Health. Is there a motion?
I move for Dr. Linda Boxham to be the chairperson of the Porter County Board of Health.
Is there a second?
I second.
Are there any other nominations to be offered?
I nominate Dr. Osan to be vice. Is that his name?
Yes, yes.
Sure.
I-
Is there a second to that nomination?
I'll
I-
second that.
Second.
Okay. Then let's take a vote, unless there's anybody wants to give a campaign speech of any kind. All in favor of Dr. Boxham being our chairman for the rest of the year indicate such by saying aye.
Aye.
All opposed? Okay, looks to me like it's unanimous. So I will close the vote on the chairperson, and congratulate Dr. Boxham for another year on the job. Anything you'd like to say about that?
I thank everyone for the opportunity. It has been a great joy to serve as chairperson the last few years, and I feel like we're in the middle of getting a lot of work done, so I appreciate the opportunity to continue on that path.
Thank you.
Thank you.
Now I'm looking for a motion for the position of vice chairperson.
For Dr. Osan?
Is there a second?
Second.
Any other nominations? I'll declare the nominations closed and indicate we'll take a vote on the vice chairperson position with the understanding that we have a vice chairperson since there's nobody else interested in running. All in favor indicate such by saying aye.
Aye.
All opposed? The ayes have it. We have our leaders
Thank you.
for the next 11 months. And with that in mind, you can take a deep breath, and Hollenbeck's going to give us the.
You like it a lot.
Yeah. He really wants it, but
All lawyers dream of hitting that gavel, don't you?
I have you on speed dial.
Yeah.
I promise nothing.
All right.
Paige Patrick.
Man.
On to new business. First up is 2025 HFI funding proposal from Porter County Sheriff's Department for first responder mental health support. Dr. Bell. Thank you for joining us.
Oh my gosh. Thank you for having me. How's everyone doing?
Excellent.
How about you?
Garrett?
I'm doing well, thank you. Happy New Year. So, where do I start?
Whatever you'd like to start.
Mhm.
We have received
We
a
have
copy
your-
of your proposal.
we have a copy.
Okay.
Where were you born?
1969. Long time ago. It doesn't feel that long until I look in the mirror.
Right?
Oh my goodness.
Like,
1990 was only 10 years ago in my mind. So, right? Absolutely.
So last year I came before you guys and asked for your generosity in funding a very first police wrong category, police psychoanalyst in Porter County at the sheriff's office. This position I kind of created a few years ago in Alpha PD when I was the chief there, and it was a real benefit to our police officers and employees that are exposed to critical incidences and stress-related situations on the job. And we saw such a success story in it when I became sheriff. I thought it would be very beneficial if we could do this countywide. And so at Valpo, we had paid Dr. Dennis Shelby $10,000 for just Valpo. I convinced Doc Shelby to go ahead and offer those same services countywide to all the first responders in Porter County. And he gratefully agreed to. And then I came to you guys and asked for that money. And what I'm glad to report, and what you have in the letters, is that it was a complete success last year. The letter that I provided you, it kind of broke down what Dr. Shelby kept track of. Now, what I might add, what's not in here is the numerous phone calls I had with them and texts, different times throughout the year, different agency heads would reach out to me, and I would kind of preference the meeting between those agencies with Doc Shelby, just kind of make it known. Kind of, I was gonna say, is that my phone going off or is that yeah. But anyway, like I said, it's been fantastic. In that letter, it shows that he spent 22 hours with administrators throughout the county, different organizations, with peer support, planning, identifying needs, and basically creating a dialogue with the administration. Because that's one of the things that were very important, is that we had to get these different entities really to buy into Doc Shelby and what he wanted to help our first responders with. So we did that. He spent another 7.5 hours with 10 different clients throughout the year, kind of just doing initial assessments on what was going on with them. And this was not only just stress-related incidences, this was also issues that maybe they needed some guidance at home, things that are going on. And, what I can't say enough how important this is, and for the well-being of our first responders. I've said this many a times throughout the years. If we're going to expect our first responders to handle the worst situation in a lot of people's lives, we have to make sure that they're okay. And this is one of those steps. We've done some, I think, really good things throughout the developing the overall wellness division at the Porter County Sheriff's Office, with now having 2 social workers. We brought on, developed a LOSS team, which is a local outreach for suicide survivors, that gets dispatched throughout the county for those type of critical incidences. And this is another component. And I know when I came before you last year, I said, let's give it a year, let's see how it goes, and then if I could write this into the budget and fund it for other funding sources, which would be like the general fund, I would do that. I think we all know that the challenges that we're all facing at the county level. This year I wasn't able to write that into this budget session, okay? And so that's why I'm coming before you again this year. Last year we talked about it. I know that it was kind of said, well, you're gonna have Doc Shelby and his ability and his resources for $10,000. And I said, yeah, but that might only be 1 year, right? And so what I did is I broke this down in this letter about his number of hours, which were right around 70 hours documented. His hourly rate is $175 an hour, and I broke that down to $13,825. I'm asking for 14 because I plan on using him even more this year. We've talked about developing more PowerPoints, more training at the crew levels, at different situations. And so I know that it's going to be above this, but I think we're in county government, so we have to take things slow. We have to build up, show a need, a justification, and that's what I'm hoping this letter showed this year. I'm here to answer any questions you guys might have with the information that I provided you. So I'm going to just kind of leave it at that for right now.
Sheriff Felton, was he used with the other police departments as well as you described?
He was.
Valpo, Chesterton,
Yes.
all of them.
Yes, he was used without going into all the agencies.
Yeah.
Because I don't want to really, one of the things that's important with Doc Shelby is that there's that confidentiality, right?
Sure.
But what I can tell you is that it wasn't just police agencies that reached out,
But it's countywide.
but countywide.
Yeah, which I amazing.
any.
So the numbers in this report reflect countywide, not just sheriff department, or is it just sheriff
No,
department
this is
specific? Okay.
I personally am honored to be able to assist with this program. I think, as you have been, it's extremely important to take care of our first responders when they're taking care of us in our most trying times. So, I think this is a fabulous thing to continue to support, and I feel that we're fortunate that we're able to be able to do so in these times as you described in the county. And these are things that are tight and have the capabilities. I think there's nothing of more value to give our funds to.
And I appreciate that.
I personally, if everyone is in agreement of this, when I was looking through these numbers, because when did you come to us? Was that even the full year?
No, it was not.
Right.
Mm-mm.
So in my mind, I was thinking if everyone is in agreement of 15,000, so that they don't have to worry if we exceed more than, like you say, I want to give you the opportunity to expand and offer this more to your first responders.
Just doing the math. What month was it? I mean, it was late in the year, if I'm not mistaken. It was.
It's all blended.
Yeah, but I mean, it was definitely past halfway through the year. So if you've tallied up close to $13,000 worth of revenue that needed to be paid to him for that, that means that potentially we're looking at almost double that. So I absolutely agree. 15 is even. That's a bargain at this point.
Well, and I think we're here.
Yeah.
We're open, and I know.
Right.
Speaking to Carrie, like we had earmarked in this budget for this to possibly happen, right? That we had this put aside at the 10,000 that we did last year. So to exceed that, we're going to have to go to the county council or commissioners to approve.
Yeah, just
Yes.
the reappropriation.
So if when we get past the 10,000 mark, then if we need to, we can bring them back
Absolutely.
to the board to do more. But I think that's a nice starting point that we can go to them and see.
Because from my records, it was March 5th
Okay.
when you appeared in front of us.
So
We're
it
almost there.
hasn't even been here yet. But yeah. Okay.
Yeah.
And I do foresee, again, like I stated a little while ago, it takes a while to build that trust.
Sure.
Mhm.
And then you also don't know what the year's going to bring. We had last year was quite challenging on a lot of different things that the first responders were exposed to. That I hope we have less than that number of incidences or those kind of incidences. But I definitely feel as people feel more comfortable, as word gets out, that look, it's not going to be advertised who's talking and what they're talking about, and you build that relationships. I think it's going to be more and more. He's going to be used more.
Good.
Yeah, and I think if we model the importance of reducing the stigma of mental health issues, it's just in general overall for, just from my perspective of being a mental health provider, reducing the stigma in any way we can to say that, people making use of mental health services is important, just as important as physical health services, and I think that that's something we need to continue, because when we did our assessment, right, for the county, we found out, mental health was really one of the top concerns and so, I mean, beyond the help, which I'm so glad that your officers and first responders are getting that, but I think it also continues to just roll out our message, right, that mental health is very important, overcoming the stigma, trying to reduce suicides, trying to reduce, what we're seeing just as, this public health epidemic sometimes with, depression and anxiety. And so I really appreciate, the bravery of those people really to come forward to ask for help, because, then more people are empowered to do that. So thank you for doing that.
Well, thank you for your support.
And I will bolster that as a primary care physician. I can tell you that the physical health is almost impossible to achieve without mental health being in the right place.
Yep.
So, and I stress that to my patients. So you're 100% right, doctor, in the sense that there could be no better way to emphasize public health.
Mhm.
And thank you for what you do.
Yeah, thank you.
Appreciate you.
Sit there long enough and you'll get more.
So if we could,
I have an apology to make. In my excitement of being handed the gavel, I forgot that we have our new Board of Health member present, and I apologize.
me too.
And I'm going to put to our newly crowned chairperson to introduce you to the rest of the board.
This is our new board member, Michelle Cherry from Portage, who was nominated by the Portage mayor. This is a new method of appointment of board members, and I think it's particularly exciting because part of state statute now includes the largest city in our district, which is Portage. And so I think it's exciting to, make sure that we have representation from our largest city. We've been typically short of representation from Portage, and to have that introduction or more involvement on the board, I think is very exciting. If you don't mind introducing yourself, I've had the opportunity to meet her, but so that everyone knows your story, your history, your background.
My name is Michelle Cherry. I've lived in Northwest Indiana my entire life. I was born in Hammond. I've been a nurse for 27 years. I have my doctorate degree. I've done different things in nursing. I started in adult med surg, went to chronically ill peds, was a NICU nurse for a long time, and then I've been in nursing leadership for probably 20 years. Now I am in risk management, so I'm looking at nursing at a totally different aspect than I've ever done before, and I just started that. Since my position changed and I wasn't working 60-something hours, I decided to try something different, and this opportunity came up, so I'm very excited to learn about the county that I live in, because there's lots of this stuff as I'm reading it that I've never known that existed. So I think having the ability to be part of that and help get that message out so we can improve the health of our county is huge. So thank you for having me.
Welcome.
Thank you.
And to get back on.
And I apologize.
Yes,
Oh,
no.
no.
We should have done this way.
I'm going to get some mental health
Yeah.
training.
You've got my number.
I do have you.
And I was going to bring Dr. Shelby.
Yes.
Right,
That's incredible.
meet everyone.
Yeah.
He's heading to San Francisco right now for a bunch of brainiacs getting together to chat. It's the Psychoanalyst Committee.
Good for him. Yeah. If we can have a motion to approve the First Responder Mental Health Support funding.
Motion to approve.
Second.
I'm sorry. Are we approving it as requested, or are we approving it as amended?
I was
As amended for 15,000.
Okay, I just want to make
Yeah,
sure we're
right,
on the
we should
amended.
clarify.
Okay.
Dr. Foster,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Kathy.
Okay.
I'm sorry. I'm so sorry. Dr. Osama,
Yes.
Terry.
Yes.
Thank you.
Okay, thank you very much.
Have a lovely evening.
Thank you, Sheriff.
We're just all getting back on track.
No.
All right, next up will be our funding proposal for the autism elopement group.
Yes, and as Kelly comes up here, I wanted to do a really quick introduction if that's okay. So I'm going to run her presentation, but this is Kelly, and Kelly works with us at the health department. She's one of our vital records registrar, and she came to us with an amazing proposal that she had written up wondering if the health department could fund and put together these autism elopement kits. And so this would be something that she's going to present to you. If the board feels moved, that we would hope for a motion and approval that this would be something that we would fund out of the maternal health, trauma and injury prevention space where we have money allocated. So I will turn it over to Kelly.
Thank you for joining us.
All right. Well, good evening, and thank you for allowing me the opportunity to speak with you today. My name is Kelly Burke, and I'm the mother of a 12-year-old son with level 3 severe autism who has exhibited elopement behaviors. I know firsthand the fear that comes when a child wanders, and I also know many families face the same struggle. That's why I'm here today to propose an autism elopement kit that could be a vital tool for Porter County families. My goal is to not only bring awareness to this issue, but to provide practical solutions that can help prevent tragedies and ensure the safety of our most vulnerable children. So, just a little bit of background about what wandering elopement is. Some people, when I say elopement, they think marriage. No. Wandering elopement is a tendency for an individual to leave the safety of a responsible person's care or safe area, which may result in potential harm or injury. This might include running off from adults at school or in the community, leaving the classroom without permission, or exiting the house when the family is not aware. This behavior is considered common and short-lived in toddlers, but may persist or reemerge in those with autism. According to the research, nearly half of the children with autism are at risk from wandering away from a safe setting. Because people with autism are vulnerable to dangerous situations, including drowning, traffic accidents, becoming trapped in hot cars, etc., it's important to take critical precautions and be aware that drowning fatalities remain a leading cause of wandering-related death along with traffic injury. Some statistics, so approximately 50% of children with autism have engaged in elopement behavior. In 2024, 56 children and 2 adults have died after going missing from settings such as homes, schools, churches, and parks. This includes 5 children who have died since November 12th of 2024. The vast majority of these deaths were caused by accidental drownings, and as most of you know, nurses and doctors, people with autism are drawn to water. A few more statistics. In a 6-year study that was done by the National Autism Association, wandering incidents occurred under non-parent supervision 45% of the time, meaning schools, relatives, and other caregivers should be made aware. Half of parents report receiving no guidance or addressing elopement. When my son was diagnosed at Lurie Children's Hospital at 2, I was given a piece of paper with his diagnosis and good luck. It wasn't until he eloped from our home that I knew, oh boy, this is a real problem. From January 1st, 2011 to December 31st, 2016, the National Autism Association collected missing person cases and found missing cases in the U.S. involving individuals with an ASD who wandered or eloped from a safe setting and were serious enough to require media and or police involvement. I'm sure you've seen it on Facebook being shared from local news outlets, missing child. Of 872 reported ASD missing person cases collected in the sample period, 808 U.S. cases, including 139 deaths, were determined to be the result of ASD wandering and elopement. Well, why does elopement happen? Elopement is typically a form of communication. As we know, most kids with ASD are nonverbal or have limited communication ability. So they're usually running away from bothersome noise, commotion, fears, phobias, demands. My son eloped from the house at 6 a.m. because he wanted to go to Walmart. He didn't understand that we can't do that. You can't leave safety. These impulses and incidents can increase with added anxiety and stress, especially if the individual has challenges with coping, calming, or regulating their emotions. Prevention. Preventing elopement in children with autism requires a combination of strategies that focus on supervision, environmental adjustments, communication skills, and safety training. Some of the strategies I've highlighted: supervision and awareness, environmental modifications, communications and skill development, behavioral interventions, emergency plan, involving the community and professional support. So the Autism Elopement Prevention Kit is a comprehensive, easy-to-use solution designed to help parents and caregivers keep their children safe. It includes tools, resources, and technology to prevent wandering and ensure peace of mind. So what I handed you was an infographic that I would like to include in the kit. It gives a brief overview of what wandering elopement is, along with some strategies, and it also explains how to use what's included in the kit. So first, we would have a wearable GPS tracker, which is actually a bracelet that can fit in an air tag. Also, it would include door locks. So these door locks go on the top of the door, they flip over, so young children are not able to reach them, and a parent, you have to squeeze it to bring it back. The window alarms are also in the kit, so you put them on the windows so that every time they open, it sends an alarm. Also included would be social stories and visual aids, which I've actually brought an example of that would be included in the kit. So this is a social story that parents would be able to read to their children, and it's called Running Away Is Not Okay. Also, we would provide stop signs. Visual aids for kids with autism are huge, so you'd put this on exit doors. Parent caregiver guides, which would be what I gave you, emergency response cards, and communication tools. The next page would be the cost breakdown. So to start with, I think modestly start with 50 total kits. The GPS tracker would be $7.99 each, so $399.50. The 6-pack window alarm times 50 would be $1,217. The 2-pack door lock would be $899.50, and the box to package the kit $79.02. So the total cost for 50 kits is $2,595.02. For parents of children with autism, elopement is a serious concern. I wish a parent would have advocated and I would have heard and had this kit available for me. It would have saved me a lot of heartache, a lot of 911 calls. So I appreciate your time.
I applaud you for taking this initiative on. When people ask me about working with the health department, I constantly say how much I'm so proud of all of you and the work that you all do. I've never met you before. Every day I meet new people from the health department, and the things that you take upon yourselves to serve this community is humbling and overwhelming. I have a loved one in my family who's also autistic, and we call him an escape artist. He's 14. It would have been fantastic if we were ever exposed to something like this. One at my sister's house, one at my mom's house.
Yeah.
She watches him. To have something put together so cohesively for people to be able to just pick up and get and bring to their home. These items are expensive. It's difficult to afford all of this. Despite the fact that it's for the safety of your child, it's not easy to do. Even coming up with a stop sign graphic and things like that is so brilliant. This is a huge issue, and I'm so thankful for you to bring light to this topic. And I commend this, and I think this is a very well use of funds.
Thank you.
Have you utilized the GPS tracker for your son? I'm just curious if
So I actually use Life 360 for my son. So if you know one child with autism, you know one child with autism. Every child is so different. So when he was younger, he had a hard time with things, bracelets.
That's why I was.
He had some sensory issues. Yes. So the majority of kids with behavioral modification therapy can be okay with wearing a bracelet. So a lot of ABA therapists will have their clients wear ID bracelets, and that will be one of their goals is for them to tolerate that bracelet. So this is something that, yes, maybe not every child will be able to tolerate. I hope that the majority will be able to in time.
Can it be removed?
It can be removed. Yes. Yeah. It's it.
Their shoelace.
Yes.
Necklace.
Yes. Yeah. It doesn't have to be used as a bracelet. They can attach it to a backpack. Essentially what it is, it's a bracelet for an AirTag. So that's basically what it is.
So I will tell you, I personally use AirTags on my children whenever we go to amusement parks. We just went to Disney last year and they had tags on them. So there's a lot of different ways to put them on. This is an excellent idea. I cannot emphasize that enough. My question to you is, how is it going to be dispersed? How do we get this into the hands of the people that need it?
So I would start with the community itself, getting the word out, social media, but also contacting our schools, letting special education teachers know, hey, if you got kiddos in their IEP where, they have elopement risks, we have this kit available for your family. I actually reached out to my son's teacher today, even though she's in LaPorte County. She's bummed about that. But she is, she's very excited about the potential for having something like this available for her students' families. So I think start with the schools.
Do we have an idea of how many children have autism within our county?
So the national, according to the CDC, is 1 in 36. That's on a national level. I tried to look for the statistics for Indiana. They don't break it down per county.
Yeah.
Unfortunately.
Yeah.
Can bring in them.
Center Township trustee that for the Valpo School District, they had a kind of autism information session.
Right.
How to get like your house registered with the police so that they know. And the school administrator, she had the numbers of all of those people in the Valparaiso School District. So I imagine with our school liaison and our school districts, I mean, that doesn't hit our under-school age kids, but at least with that, it's a good place.
Well, the reason I ask is only because I think 50 is just an undershot. I mean, it's a start. I agree with you completely, but I'm just trying to look like forward as.
Wouldn't help know these things? Self-school?
I mean, if the ones that are in self, but all of the autistic children in the school district aren't.
Right, but I mean, a lot of kids get diagnosed with self at the age of 3 when they do their assessment, or even
Jacob's ladder.
First steps thing.
Yeah.
I think that's where these kids would probably be utilized the most, is families that are trying to navigate newly diagnosed child for sure. That's usually when coming into some of these.
Yeah, I mean, unfortunately, I did first steps, Jacob's ladder, special education preschool, and unfortunately, not one person brought this to my attention. So, yeah, I mean, maybe first steps would be a great place to start.
Yeah.
When Kelly was getting her information together, I asked her to price out the kit and just suggest a number. But as far as, what, if you guys want to choose another up to, of course, if this is something that's approved for us to begin this program, then we would use our government negotiated spending and go on to SpendBridge and find out like where we can order these different things. It's a single website where we put in what we're looking for, and it's all negotiated government pricing. And it will tell us what site on there is the cheapest, and then we kind of pick and choose. That's how we order things. So, maybe we can do a little bit better on the items. And so it's if we just want to do an up to amount to put in a project or whatever.
Yeah. And I, to sort of piggyback on what Dr. Osan was saying, the criteria for distribution, it's not that I don't want to give it out to people who are interested in having it.
Mm-hmm.
I want the folks who have the highest risk of elopement activity, right? And that's hard to really, operationally define, like who has the highest risk of elopement.
Right.
But as the autism spectrum is very varied, as you said, if you have one child with autism, one, right?
Yeah.
And over 30 years, I've seen hundreds of kids that vary on the spectrum widely. Some elopement risk is much more significant
Yes.
than others. And so I would want in whatever way we could figure out that to be distributed to the folks who has the highest need or maybe the highest level of risk. I don't know how we might.
I mean, maybe we could work. I'm sorry. Maybe we could work with the schools on, and they can let us know, hey, this kiddo has a much higher risk here and could really benefit from this.
2 points. One, the fact that ideally the child would have to have shown that behavior at first to have done it, right? So figuring that out, do you risk having the child elope before you even give the kid out, right?
Right.
So that's one step that needs to be figured out. But the second part is, and to my point earlier, it's not that I don't want to spend the money.
Sure.
My problem is I see that this would be a lot more expensive over time because it would be successful.
Yeah.
So that's why I kind of want to see what the numbers look like, because this could potentially be a lot bigger than what we're looking at right now.
Once the word would get out,
right,
make sure that it's not just like a free for all, right?
Exactly.
Just coming in to get a loan.
100%.
Though there has to be some qualification.
Right. And I think
right.
Just like with our certain programs, we have to have an application. So maybe that would be a part of it, that they would have to apply for a kit, and maybe only one per family. I mean, I'm not sure, what other stipulations, but I'm sure. Yeah. Right. Exactly. So that's,
There's a lot of things that need to be worked out here. Not for the bad, for the good.
Right.
Yes.
Exactly.
Yeah.
A starting point. And,
Yeah.
I think I always get frustrated with how do we connect people to the services that we have.
100%.
So I hope it's utilized. I hope this does get out and gets used, because I tend to struggle on the opposite end of the spectrum, that we have all these programs and people aren't using them enough. So,
So would there be the ability to, we were talking about distribution, right?
Mm-hmm.
So the concern is, right, getting it to the folks who need it the most.
Yes.
Would there be an opportunity to develop some kind of a needs assessment, based on the history of the child, or like you said, just talking to mom, an application that would include, I don't know, an example of something else that we've done where, we would be able to identify, all things being equal, we would be able to identify who was at higher risk, which children are at most risk.
Yeah. And I think maybe working with the schools, like I said, would be the best place to start. Yeah.
that age.
Yes.
Right.
Time of diagnosis.
Right. And they have the most data, so they can kind of determine, hey, this kiddo really could benefit from this.
So they would have all that information.
Oh yeah. Yeah.
Out of the classroom would.
Yeah. It would probably be included in their IEP.
Right.
Yeah.
It would be identified as one of the that's addressed.
Yeah.
They do.
Precautions. Terry, when you look at the IEP, there's elopement precaution, right? Or like past behavior of elopement, and so that's generally the things that we look at.
Sure.
And so, I mean, we've put together these kits just sort of on the fly, right?
Yes.
A lot of the patients that I've seen, we've gone to Home Depot, got the locks, right? We've done back in the day. I mean, there was amazing ways that we created these kits. So for you, to sort of bring it all together is awesome. And like I said, if you can get a more of a lower price, that would be awesome as well. Because I know families have gotten very creative in their elopement over the years.
And would this kind of information be on our website? I think that would be great too.
Yeah, I'm sure that could be arranged. Yeah.
Absolutely. It's hard to find help.
Mm-hmm. For Terry,
Be utilized.
So should we vote upon the dollar amount of $3,000 and see how much they get for that based on the
Trial.
thing? And then,
What time frame would you like to put on it? 6 months?
6 months. Especially like by our health fair.
Yeah.
Yeah.
Yeah, absolutely. Mm-hmm.
Yeah. I think that's a good idea.
Mm-hmm.
Summertime would be.
Yeah.
That would be great.
Have our health fairs. And like I said with Sheriff Fallon, we're here. If
Right.
we want to amend this
Absolutely.
That's a good problem to have, in my opinion.
Yeah.
And
Well, heck, they might be able to refer some family,
yeah,
you know.
absolutely, you're right.
Yeah. So
In the
the
They get called.
Laporte Sheriff's Office knows me by first.
Fortunately.
Unfortunately.
Right.
Yeah. So should we start with a proposal for the 3,000?
Yes.
Um,
Sounds good. I make a motion for let's start with 3,000 for 6 months and reevaluate in summertime before next school year.
Yeah, I second that.
Amazing.
Dr. Lawson,
yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
yes.
Dr. Osuna,
Yes.
Terry.
Yes.
Thank you.
Thank you guys.
Thank you.
Oh, thank you.
Thank you so much.
Thank you.
Sharing your personal story and making
Yeah.
potential benefit to your community.
Thank you guys.
All right, next up, proposed clinical restructuring and associated job description.
That's what I was wondering.
All right. So while Jess is standing up, I'm going to run her slideshow as well. I just kind of want to start off. So, as you know, Connie retired in December and Jess was hired as our director of nursing. One of the things that she talked about was potential restructuring of the department. And as Dr. Stamped announced her retirement, and we knew that we were looking for a new health officer, it was really important to us that we get our new health officer in and settled, and that be a decision that they talked about and they made together for the department. And so now we've had some time, and Jess and Dr. Guimond have met and discussed the proposal, and so that's what she's here to propose to the board tonight.
Hi guys, I am asking for a restructure of nursing's department so I can improve outreach efforts and expand our services. So previous to me being there in 2023, the previous director of nursing had 8 full-time nurses, 3 part-time nurses, and the services that we provided were very limited. So we only vaccinated on 2 days a week. And we only did a schedule on 3 days. So now I have downsized our staff to 6 full-time nurses, and we offer everything 5 days a week. Amazing. Because it's what we're here for. And I mean, not only do my nurses do the clinics and all that, they also have their own individual, like my ED nurse, I've got my these nurse. So everything is covered, and I'm doing it with 6. So what I'm looking to do is, it took a while to get my house in order. So we started all over again, seeing patients and, talking to them about, all right, we got to see kids every day. We got to take every walk-in that comes in. This is what we're here for. This is what we're doing. So we are good on that. We are functioning 100%. So now what I want to do is expand services out. We have this mobile unit. I want to use it. Unfortunately, I have 6 nurses. I need to have an outreach specialist whose only job is scheduling the mobile unit, doing all the outreach. So if I'm able to do that, I would also like to reinstate a nursing supervisor. So I know that I basically have a charge nurse on the clinic when it's out, and then one in the office. So she would be my backup. And then I'm also advocating for our office manager to make more money because they have taken on extra responsibilities with the HFI. So what it was doing before was a little compared to now. So she's taken on, all the financials that come with the HFI. She's doing that as well.
And I just wanted to make a note about our office manager position. So this was one of the first things when Sheila was doing her transition with me, and I had the salary ordinance. That was the first comment that I made. When we had our wage study done in 2022, that position was left off the wage study. So the position description was sent up, but the questionnaire that was filled out was missing. and then it got redone and it went up and it was missing again. And so it kind of got missed in that whole thing. So that job classification, that job actually wasn't classified correctly. So it's classified as a COMOT. And so I actually have met with the auditor's office about, that feeling as though that's the wrong classification and asking what we needed to do for that. And so this would bring that to a PAT position, so professional and technical position, that, would require that degree or equitable experience to come into that position. And that is definitely something. She oversees 9 positions. She has to be cross-trained in every single one of those. And we are very fortunate. We do bill for services, but that's one of the things we're going to be looking to bill more for services. So we've added some community health workers. Some of our staff's trained as community health workers. They can bill for some of the things that they're going to offer and things like that. So those duties are just going to increase in addition to that supervision with no further classification or compensation. So that's something that, we've also, knew that change needed to be made.
All right, so I know what I'm asking for. It sounds like it's going to be a lot of money. However, I'm going to save you $3,000. I'm going to take one of the full-time nursing positions that I don't currently use, and
That we've budgeted for.
correct, and I still have part-time available that is also budgeted for. If we take that position and split it up in 3 ways, we save $3,000. Don't see how you could save it.
I mean, the fact that the bottom line doesn't.
Have you ever sold cars before?
You can fund Kelly stuff with Steve. That's right.
Honestly,
The $3,000 in savings. Did you work together? Yeah.
I'm just saying the $3,000 savings here.
Yeah. So basically, it's just the redistribution, right? I mean, is what we're looking at, just of time and sort of whatever their job description is, and then the money. Okay.
Just being able to get out of the office with somebody that is
Yeah.
in place, that's their only job.
That's their dedicated position to do that. Okay.
because we have that mobile health unit,
Yeah.
we have been struggling to find opportunities. They're tasked in so many ways. I also really appreciate this being available to our community 5 days a week, because that was one of the big feedback points that we got, that it's hard for me to make an appointment just those 2 days.
Right, and in walk-ins as well.
Walk-ins,
It's
they get a note from school that this
Yeah.
vaccine is missing and they need to get this done right away. They could just come in and do that, or whatever. They went to the doctor's office and got told they need their RSV vaccine, and they just come straight here to get it. And all the other testing that you offer, whether it be the lab work, the STI testing, that people can just come in their time of need and not have to worry on Tuesdays and Thursdays to get here, and still be using the same budget that we're using. I think is tremendous. The position of the office manager, I mean, it's been a talk for a while that it's been underpaid even when Chris was doing it. So we've been getting away with this for, I think, a little too long, and I think this position definitely deserves that increase to reflect the amount of work that they have both put into this position over time.
And is that both Valpo and Portage? Okay, so this is it's the whole county. So the office manager oversees both offices?
yes.
I mean, that's an additional thing, right?
Yeah, so underneath, she has all the registrars underneath.
Yeah.
So the vital record staff,
In
our mental support staff in both locations. Yeah.
Okay.
So yeah, that's it. There are several programs that have to be. Yeah.
I mean, if the money's already spent allotted for, I can't imagine why that would be an issue.
I agree. And I think they know amongst themselves how to best distribute themselves in terms of getting the job done.
Mm-hmm.
So I think just makes sense.
How can we say no?
Yeah.
And we're saving $3,000.
Everybody else asked. I'm giving back.
Like,
But I think even if you weren't saving
Yeah,
money,
it would still be.
you're
still
using it where
yes.
you need it.
Correct.
So you're moving funds around to maximize your productivity.
And,
So I think
and the part-time nurses that we had before, that was who did our children's immunizations. So that was what they did. Like they were just trained to do children's immunizations. And so now that we have those part-time positions, once we get the outreach and we get the mobile unit out, it's using it in a different way, right? And so then if we, hire part-time, it's not, and you have to work the days that these immunizations are on the schedule. We're working an outreach clinic, and we have nurses that can be community health workers from that community. We can kind of look at it in a whole different way and service our community better through those positions as well.
So does this need to be presented to county council?
Yes, it will go
Because
before
we have the job description?
Yes. If it's voted. So that's this form you guys have in front of you. That is what they will receive if you guys approve it this evening. Then on February the 25th, I think that's the Tuesday, then we will be on the council agenda, and they do approve job descriptions and this form, the 124, to approve the pay out of the fund.
So is the motion, would the what we entitle this would be the statement of salaries and wages, and then restructuring of job descriptions.
And when are you hoping to get these positions filled by?
So our office manager.
Well, I know that, right? That one, not
our nursing supervisor position is filled as well. It's been filled in name.
Okay.
Crystal's our nursing supervisor, and so she's been doing those duties.
Gotcha.
Without additional compensation to this point.
And then the new one, I think we would make to the public, put on.
Okay, so really only one position is what we're going to hire.
Yes.
Okay. Gotcha.
So that will post on the website for the 30 days through the.
Okay.
Well, I make a motion to approve the clinical restructuring and associated job descriptions along with the amended pay schedule that goes along with that.
I'll second.
Dr. Watson?
Yes.
Dr. Flemming?
Yes.
Michelle?
Yes.
Robin?
Yes.
Terry?
Yes.
Thank you.
Thank you. Old business, tobacco grant.
I just wanted to give a quick update. I know at the last meeting I had told you that they had the tobacco grant that we thought was ending on June the 30th, 2025. That actually was not the case. It was the tobacco grant that they put out for coalitions that was put out and sent to all the local health departments, because there are some counties in which there is not a coalition. And so the health departments are tasked with that as their core services to begin a coalition. So there was a capacity building grant for new coalitions. So the one that was out for proposal for our Tobacco Education and Prevention Coalition for Porter County, which we are a part of, and we worked together, a group of us, with Carrie Higgins, who is the director of that coalition, on her grant application, along with a letter of support. So I just kind of wanted to update everybody about that. We had believed that our grant was ending on June the 30th, and that was indeed the case. And so part of our budget that was approved for 2025 was to roll that specialist, because we do share that part-time individual with the Tobacco Coalition. The reason that's really important is because they, under their grant, are not allowed to deliver education directly to students. So that is what, her name is Allie, and she's the tobacco education specialist, and she works 3 days a week with VU for the Tobacco Coalition, 2 days a week with us. With us, she's able to go into the schools and support the educators by delivering the Catch My Breath program, because as we know, teachers are taxed in their time. So the Tobacco Coalition can train them to train their kiddos, but they can't deliver it. And so this really helps. So that for 2025, we had rolled in for the second half of the year into our Health First Indiana funding that had already been done. And we did get it approved at the council to begin paying her out of Health First Indiana as of July the 1st. So just kind of wanted to update everybody about that and apologize for that miscommunication.
As of July 1st.
Yes, so that
2024.
Our grants, our pass-through grants are July 1st to June 30th.
Okay.
And then our budget is January 1st to December 31st.
Okay.
Very confusing to budget for.
Report of board attorney.
Brevity is a virtue.
Amen.
keep telling me
Mm-hmm.
that. First of all, we hopefully will have the seventh and last member of this august body appointed by, under the current statutory procedure, the county council makes that seventh appointment, and we're hoping that they will do that at their meeting at the end of February. So we'll be fully constituted with the seven of us. Yeah, I'm gonna get a little philosophical here if I can have a platform just for a couple of minutes. As reflected in the two programs that you approved this evening and the staff brought to you, it's my incredible pleasure to work with a group of people downstairs who are doing amazing things with the Health First Indiana program, and I congratulate them. As I go around the state, there's a lot of that going on, but you can't help but get the vibe that in Porter County, we know what we're doing, we know what the goal is. If the slogan hadn't already been taken by the Salvation Army, they're doing the most good. And it's exciting to see that happening in a state that has lingered long and many years behind the curve in terms of public health issues. So I want to publicly indicate to you that it's a pleasure, and I take pride in my ability to work with them. I'm specifically reminded, Senator Charbonneau, I worked with Senator Charbonneau on this whole program, and there was a lot of pushback in the legislature about who was going to get the money. And honestly, I'll tell you, there were legislators who, I don't know how to say it other than to say they didn't trust us. And boy, are we proving them wrong. And it's going to be an exciting time with the new budget now to see to what extent the funding for this programming can be continued. But we owe this to Senator Charbonneau. And I know he's talked to me about this, to have his home county come through the way we're coming through with this programming. It's prideful for him as well. So publicly, keep up the good work and let me continue to drag along with you. End of report.
Thank you. So the claims and receipts made its way around. We can get a motion to approve our claims and receipts.
I'll motion to approve.
Second.
Okay, Dr. Watson,
Yes.
Dr. Brooke,
Yes.
Michelle,
Yes.
Robin,
Yes.
Dr. Rossell,
Yes.
Terry.
Yes.
All right, reports of committee staff and health officer.
Do you want to go first?
Just should I discuss that part on the screen? Worth bringing up. So one of the things that came up, and we haven't actually renewed the agreement, correct, with Northwest Health for those
Yeah, so we have not renewed. We have the screening services agreement, the amendment. We're still waiting on that final.
So we were looking through what was offered as a quote screening. The things that are on there currently were EKG, echo, and mammography, CT, low-dose CT screening for lung cancer screening, and AAA screening. And so looking at those things as a screening tool using USPSTF data, United States Preventative Task Force guidance, I couldn't justify keeping the EKG and the echo on there as they're more diagnostic. And I think I was looking at Dr. Stamp's old notes and kind of running things through, and she also was having a hard time coming up with what would the criteria be for someone to get an EKG who came to us. And, is it, blood pressure parameters? Is it, there was various criteria that I could see through her notes she was trying to come up with. So, using the guidance from USPSTF, they do not recommend those two tests, echo and EKG, as a screening diagnostic tool, or screening tool, more of a diagnostic tool. So they have no position statement. So I think taking those off the list would be the right thing to do because I think it puts a lot of it back on us as to how we would screen people to even get those two tests in the first place, and then what do we do with that information after we get it. The other ones I have no problem keeping on the list. They're recommended by USPSTF, especially the low dose CT and the AAA screening, and of course the mammography, which we've just outlined some of the parameters and who would qualify for those, and as far as supplementing or getting that discount on those tests. And then the only other thing we were waiting on was possibility of adding the coronary calcium score as something. So that's the only update I have, removing the echo and EKG off the screening and then possibly adding the coronary calcium score to it. That is all.
Then I'm going to give a super quick update. So we did receive our quote from CWS for the POCO Wellness Connection Initiative portal, and a little bit of sticker shock. So I think that the quote was reasonable, but I don't think that we're there yet. If we knew that we were going to start with 1,500 users, it would be one thing. But I think, and thank you, Dr. Guimont, for helping me think through that. But we are going to start internally with our own IT and build out a portal. And Chris already had offered; she's very excited to be able to help enter that information on the back end and to run the portal and do all of those things for us. So on February the 20th, I believe it is, we have a meeting with IT along with our interns, to work to begin the designs of our portal. So we're still aiming to kick off the initiative on June the 13th for the health fair. So I just kind of wanted to give you guys those updates. I also just wanted to point out a couple of things. So I did reattach the request for application that's out for our physical activity and movement programs, because I wanted you to see those changes that we discussed last month, as well as the rubric for you guys when you're going through and deciding on funding for those. So that's on there. So any feedback I welcome. Also attached a rubric that we came up with for when programs have had their year and we would like to evaluate our experience with those and give those to you when individuals are coming for a possibility of refunding. So that rubric was in there. Again, any feedback, please let us know. And then I just wanted to point out 3 other things that were attached. So the official save the date for our health fair on June the 13th was in there. If you all want any printed to hand out, to hang in offices, other ideas, let us know. Same for Tara's next Women Protecting Women event. And Robin, I thought about you when she proposed that event, because I thought Robin's talked about this before, that she'll be really excited about that. So again, same thing, let us know. You're obviously welcome to print if you want any printed. If you have any suggestions for places to get that information out. And then finally, the last local boards of health guidance manual was published in 2011. 2 weeks ago, they updated and sent us the document. So you have that in there. I did not want to presume that everyone would like their own printed bound manual, because some people really like digital. But if you would like a printed and bound manual, please let me know. I have 4 or 5 downstairs we can get tonight, but I can also have more done. I just, like I said, didn't want to waste trees but that's what it's there for. So let us know. And I think that's it for me. And I think Dan had something really quick. And if anybody else has anything, jump in after me.
Back in November, we took the septic ordinance that you approved in front of the commissioners. That was passed by the commissioners, and then I submitted it. State here moved it out in December because of the holiday, so I submitted it at the beginning of January, and then on the 24th of January was the meeting, and our ordinance passed. So it's
Good.
been approved through the state, so now we can enact it. We can start registering installers again.
Good.
Excellent.
After 2 years after it. This is all of
Good
our,
job.
our staff.
Yeah.
By the next meeting, we should have our 7th member. And so I would just love for you all to return, and we can introduce all of you formally to our new
Awesome.
for the next meeting, if that works out for you all. I'm filling her in.
on who's who.
Wonderful. Do you make
It-
anything else?
Can I comment on Dr. Gimon's
Yeah.
thought process earlier? I wholeheartedly agree. I think the heart scan is an underutilized tool that I have absolutely had innumerable amount of patients that it saved their lives, that were on the verge of heart attacks and had no idea. Most hospital systems are offering it for $49, and it is invaluable.
Without an appointment. I mean, we don't
Yeah.
have to order.
Nothing. $49. I mean, honest to goodness, it is something that if you can put that together and get that for especially patients that are in the window for it, absolutely.
Just
I commend you.
think about its existence.
Yes, absolutely. Absolutely. Because the systems don't advertise it. They offer it, but they don't advertise it. No, it is invaluable.
There's two parts of this. You have it, but then you got to advertise it.
Right. Oh, trust me, the hospital systems make the money on the back end because everybody says, well, why are they giving it away for $49? Well, because you end up in the cath lab with a stent in your heart afterwards. But it saves people's lives. So at the end of the day, it's been a absolutely invaluable tool in my practice.
To clean up the mess before it hits the fan.
100%, absolutely. A pound, an ounce of prevention is worth a pound of treatment, right? So.
Preventative.
Thank you all.
Any miscellaneous to add?
Boiler up.
Yeah. Look. I haven't received any crazy texts. Do we have any public comment?
So my question is,
Can you please tell us your name?
I'm sorry?
Your name.
Oh, I'm Dawn
For-
Miller.
Yeah.
So, just real quick, regarding the adjusting of the salaries, did you receive the 3% raise that the county council gave to you guys? The health board? Did you guys receive that as well? So then you got
Board doesn't.
3% raise.
We don't get paid.
Yeah, we don't.
The board doesn't get paid.
Okay, but the employees do.
Yes.
Yes. Okay, so the health board, they received the 3%, correct?
Are you asking about the employees of the health department or the board of health?
Asking about the
Yes.
So
Yes.
and they got the 3% raise.
Yes.
County council.
Yes.
Okay, so you're asking for more than?
These are different positions.
No.
So these are positions that did not exist before. So it is a reclassification. It's a reclassification of a position that was incorrectly classified. And of course, this will have to go before council for approval. And then it is a new position that did not exist previously with additional duties. So it's not a raise on top of what they got. They're different positions.
And remember, the bottom line for all the funding that we have for salaries is lessened by $3,000 by this redistribution.
Okay, thank you.
Thank you.
And to reiterate, we do not get paid.
Well, we do
Yeah.
get paid, but we don't get paid by the health department.
Well, yeah, probably.
Let the record show that I do.
The board.
Anyone else? Can we have a motion to adjourn?
Motion to adjourn. My daughter's right there.
Second.
Congratulations to our new person. He looks a lot like the old.
Present next time.
She's a little.
Wait, so that's give another one.